Welcome back to Taking Charge of My Cancer podcast, and I'm delighted to have as a guest Dani Binnington today. She is the CEO and founder of Menopause After Cancer. Despite a welcome increase in menopause awareness in recent years, Dani, who has been diagnosed with breast cancer in her early 30s and then later pushed into surgical menopause, found that support for people with cancer diagnosis is still awfully lacking. At first, Danny set out to create online support groups, but soon realized that that was not enough. In collaboration with these world-leading menopause specialists and other experts, Danny went on to create workshops, programs, and the Menopause and Cancer podcast. Finally, the nonprofit Menopause and Cancer organization was founded in 2022 to further extend their services and support as many people as possible. So, Danny, thank you again for being here. This is from England, right?
That is right. Yeah, thank you so much for having me and for talking about my favorite topic, menopause after cancer.
Perfect. So, can you share a bit about your personal journey, your breast cancer diagnosis, and what led you to start menopause and cancer?
Mm. It's actually quite a long journey, and I wonder if anyone is listening also finds themselves on a path from their diagnosis and wherever they are now. We often end up where we don't expect to end up, right? And I never expected to do what I do my whole life, my career, everything has taken on many little shapes and turns, but it was my own breast cancer diagnosis at the age of 33 that was kind of like the beginning. And like many families, we did the best we could with what we had. My twins were two, and my eldest daughter was four. And so we navigated it with the tools we had at the time. My periods did stop. So, in retrospect, I know I was in a temporary menopause. My periods came back. And so I regained my ovarian function. But after that, my doctors told me that I was also the carrier of a genetic mutation, and many people will know it as the Angelina Jolie gene that likes to give you breast cancer and ovarian cancer at a higher rate. And so I did what I could do to reduce my risks of more cancers. Initially, that was a double mastectomy, and then later it was also removing my ovaries. And I know people are going to listen to this podcast from all over the world, aren't they? And in the UK, when I was preparing to have my ovaries removed, we kind of had a bit of an menopause revolution. We had celebrities and doctors campaigning outside the Houses of Parliament. They took to social media and they were all talking about their menopause coming with symptoms, with long-term health problems, and that it can be really difficult to manage. And so I kept asking my doctors, I said, hang on a minute, you're going to have my ovaries. What symptoms might I experience? What treatment options do I have after my type of breast cancer? And I either got no advice and they said, well, let's wait and see, or I had conflicting advice from brilliant doctors. And that made me feel very isolated, very lonely, frustrated, outraged. I had all sorts of negative feelings. And I just thought, that can't be right. I can't be the only one. And so when I then set up my first Facebook group, it was astonishing because within weeks there were hundreds of people from all over the world after different types of cancer. They had different treatment that onset their menopause, and they were all saying the same. They were saying, I've got all of these symptoms and I don't know where to go for help. And that really was quite a few years after my initial diagnosis, but it was the beginning of our quiet menopause after cancer revolution, as we call it now.
That's amazing. And I have been following you for a little while. I think I heard your podcast, like you were a guest in another of the podcasts I listened to, and has been really engaging. Like it has been a lot of things that I hear day to day. A lot of the patients complain about, a lot of the women I work with complain about. So, how did your own experience with menopause after cancer shape you understand of women health and survivorship?
Mm. And so initially, I thought it was just me. Then I realized there are many others.
Mhm.
And then what I realized, it can happen after any type of cancer. So it's really important for me, for anyone to listen to this conversation today, to think it could be after breast cancers or gynae cancers. It could be after bowel cancers, after stem cell transplants for leukemia. It's about the cancer treatment that can trigger the menopause. So if people have had chemotherapy, radiotherapy to the pelvis, if they may have had an endocrine therapy, so blocking the hormones for the cancer not to spread or to stop a possible reoccurrence, Or maybe surgery, like in my case, all of those treatments can cause menopause symptoms. And one of the real things I've learned is that the way menopause can present itself is really different for most people. I've never had a hot flush in my entire life. I don't know what that feels like, but I had loads of other symptoms. And some people have hot flushes and night sweats all the time. So, one of the most important things I learned is that don't compare yourself to others. Your experience of the menopause and its symptoms will be different to other people. And the only thing that matters is that you're able to understand that it could be potentially be the menopause. So having that awareness, knowing what these symptoms are for you and what you want help with, and then knowing where to go to for help. But every individual is different and there is no right or wrong. Some people wake up 10 times every night with hot sweats and they get on fine. And other people have a bad night's sleep once a week and it really bothers them loads.
Mhm.
It doesn't matter what you are experiencing. What matters is if it bothers you, you deserve the help from a team around you.
So, looking back, what part of your journey do you think changed you the most, physically, emotionally, or spiritually?
So I always say my physical body was on slow motion recovery to my mental health and my mental body. I kind of threw myself into diet and exercise. Initially, I took loads of supplements, and you would be aghast as a healthcare professional because I know, I was one of those patients that had cupboard full of supplements, and by the end of the month, I didn't know why I bought all of this stuff. But it gave me a bit of confidence, I guess, and it gave me a bit of control at a time where I had no control. So physically, I felt I could recover. And because my periods did come back after my active cancer treatment, I was able to rebuild my house because then I wasn't really faced with the hormonal havoc that can come with cancer treatment. But my mental health took a long, long time, and it was the anxiety and panic attacks, my constant fear of recurrence. And at a time where my whole family and everyone really had celebrated my time of active cancer treatment came to an end, it was a very, very much ongoing struggle. And I had help from counselors, therapists, cognitive behavior therapy. I really tried to grow and use lots of different strategies. And at the same time, it was still really difficult. And I think it probably also led me down a little bit of a spiritual path because practices like yoga and mindfulness allowed me to sort of tap into other realms that are maybe less medical. And now I would like to say that my approach spreads from the medical, from medication to meditation.
Mhm.
And
I love it.
everything that is in between, I want to embrace because
Mhm.
for some months and maybe years, it is a medical support I need. And then maybe it's something else that is like meditation, and there is no right or wrong. But I guess I needed a little bit of everything to help me through it.
I love that phrase from medical to meditation. I really, really think that's so important because again, we always go Western medicine, Eastern medicine, right? It's like, you do your traditional medicine and your functional medicine, but it's so many things that just really need to be embraced in the same cloud that we just need to try to like look at the whole picture and not just focus in one thing, right?
Yeah.
Many people don't realize how complex menopause can be after cancer treatments. What are some of the biggest misconceptions that you have encountered?
Oh my God, there are so many. How much time have you got? I, I keep it to a few.
Okay.
But the first misconception is that people don't have options. So many people may have been told because of the type of cancer they have had, they may not be a good candidate for hormone replacement therapy. And that's often the end of the conversation. And then people think, well, I can't have that. There is nothing else I can do. And that is wrong. It's misinformation, it's incorrect advice or lack of information. There is always something you can do, depending on your type of cancer you've had, the current medication you're on, other things that are going on with you, because we're not just our cancer. We may have an autoimmune disease that muddles its way into our complexities, but there are always some options and strategies people can try. So that's one of the first things I would want to say. The second thing is um, that people say, I can't have HRT, I can't have any hormone replacement therapy. And again, that is incorrect advice. So after many types of cancer, hormone replacement therapy is a very effective and important treatment. So, in the book, Navigating Menopause After Cancer, we've written a whole table because I'm so frustrated that so many people say, well, I didn't think I could have hormone replacement therapy, so I never asked the question. None of my doctors spoke about it, so I just thought it was off the table. But after many cancers like bowel cancers, leukemia, brain tumors, there are many cancers, including gynecological cancers, not all, but some. Hormone replacement therapy is important. And if you think about it, many people are entering menopause after cancer in their 20s and 30s. It's really very important these people access and have their hormones replaced for their long-term health as much as for their symptom relief. And so it's understanding, can you have hormone replacement therapy safely? The third misconception and myth that people always talk about is they say, well, I was told I can't have hormones, so I can't have anything to do with hormones. So they stop eating edamame beans, they stop having food with phytoestrogens, they're worried about soya milk, they're worried about tofu, they're also worried about vaginal estrogen. And so we need to sort of understand not all hormones are the same. The ones consumed in food are very good for us and very good for most of us. When it comes to supplements, phytoestrogen, we need to be considerate that they're not brilliantly safe for everyone, especially if people have had a hormone sensitive cancer. But when it comes to hormone replacement therapy, the hormones that go into your vagina and vulva, so the local treatments, are very safe for the majority of cancer patients, including breast cancer patients. But if someone has heard when they were really anxious, when they were first diagnosed, that they can't have hormone replacement therapy, they may think it's all the same.
Mhm.
And it's important to start differentiating between the different types so that we can access the right treatment that can really help us, especially for those candidates that might be on active and long-term cancer treatment. Their symptoms of sexual health might be severe, and they may really need to access some of those local vaginal estrogens.
That's a very good point. So something that we are trying to really going through now here is yes, the menopause movement is going more and more growing, which is great.
Mm,
More education is happening and so again it's a lot of that like back and forth between gynecologists and medical oncologists. And so it gets frustrated for the patient where we cannot give them like the papers that has been writing with a really good support and say, here, go talk to your doctor about that. And then one doctor is absolutely not. And the other one, yes, totally okay. But your medical oncology has to kind of give you, the it's okay to do it, or the patients feel more comfortable if the medical oncologists tell them. How do you guys manage that? Where have you been exposed to that?
mm. It's the same story all over the world. It's the experience I have made myself, and it's the experience our entire community kind of makes. And so that is the reason I have then gone and set up the podcast first, where I brought doctors from all different fields and I gave them the microphone. And there are brilliant people who really know their stuff. So there are experts on menopause and cancer. Currently, we have survivors fall through the cracks across the world, right? So oncology teams in a traditional way are there to prescribe us treatments that save our lives. They are not menopause trained. They are not necessarily that interested and trained in the long-term effects. They get you through that horrible active cancer treatment. They hopefully have done the best they can to with your survivorship to help you. And then that's it, right? In terms of oncology services. And then our general practitioner, who maybe then picks us up a year or 2 years later when we realize we still have all of those symptoms, they may not be then specialist enough to understand how they can help us. So currently we fall through the cracks. It is one of my missions to really start integrating menopause conversations into oncology services.
Mhm.
And I don't think every oncologist, every surgeon, every clinical nurse specialist needs to become the expert.
Mhm.
But I think every team can train up and skill up almost like a menopause champion within their cancer services. That could be you. It could be the people where people go for physical therapy after active cancer treatment or a survivorship program and someone has a focus on the menopause. Because otherwise, we need billions. It's not every oncologist's responsibility. I really don't think that's the case, but it could be a great idea for someone to skill up because we know over 90% of people over the age of 40 who've had cancer treatment, like the ones I mentioned earlier, will become menopausal as a result of it. And we also know that over 70% say menopause as a long-term side effect is harder than chemotherapy, radiotherapy, and surgery altogether. So we are currently letting people fall through the gaps, and yes, we could do better. I've done the podcast, I then did YouTube so people can watch with subtitles from other countries. Um, I've then compiled it all into a book. It's the best thing we can do. There is guidance out there. We can signpost people to the guidance in their country, but it's having someone's interest in a medical team to learn and look, because traditionally it hasn't been part of their job spec.
Mhm.
And so I think the more patients are now going back to their doctors to say, hang on a minute, this is really impacting me. I'm 4 or 5 years down the line. I have all of those symptoms. Many people say, I can't stay on these endocrine therapies
Mhm.
because my side effects are so severe, I'm going to come off them. I would say if we support people, they will stay on those treatments. It
Mhm.
will help us with survival rates because the compliance rate will get better if people have support. And so if everyone takes a little bit of ownership to learn more, to speak about it more, including patients, because
Mhm.
I was always the patient who thought, well, I shouldn't complain.
Mhm.
You know, my doctors have done so much for me to keep me alive. I've watched my children start school. I have been so lucky, and so many people I've met along my journey haven't been as lucky. I felt like I shouldn't complain. But
Mhm.
I also think it's patients' responsibility to speak up, even if it's years further down the line.
That's excellent. That's a great idea. I think that's brilliant. Hopefully, we can start establish that on every team. I'm gonna start to kind of talk to our team here and say, hey, how can we start implementing this? Because it's super important. What practical strategies or therapies have you found most helpful for managing menopause symptoms safely after breast cancer?
Mm. So the strategy is really to present people with a toolkit that has no hierarchy and no judgment. And in that toolkit, we have everything from lifestyle, diet, exercise, and stress to non-hormonal treatment options, which can be prescribed, to hormonal treatment options and complementary therapies. And if we think we have buckets, like big buckets, and in each of these buckets, there are these options. So, for example, in the complementary bucket, I put acupuncture. We have evidence for the benefit of acupuncture for many menopausal symptoms, for cancer survivors, for hot flushes, insomnia, sleep, quality of life, but also cognitive behavior therapy, nutrition or herbal supplements, um, and other things like yoga, mindfulness-based stress reduction programs that fall into the complementary therapies, including appointments with other therapists, for example, that aren't so just the medical. Like, you know, we have brilliant women's health physiotherapists. They can fall into those complementary buckets. In the non-hormonal treatment bucket, there are many prescribable options that aren't designed to help with menopausal symptoms for cancer survivors. But as a byproduct, they can help with hot flushes, with sleep, with quality of life, with other things that you might be experiencing, some other symptoms you might be experiencing. And so if we present people with those buckets, with that toolkit, that non-judgmental way, people can then decide, what's my belief system? Where do I want to start? Do I want to go to my doctor and ask for help? Or maybe I have enough energy and tackle lifestyle. We know that by eating a certain way and by moving a certain way, we can feel better and improve our menopause symptoms. But if someone says, you know what, I have absolutely no energy, I have so much low mood, depression, cognitive decline, I couldn't even exercise for 10 minutes a day, I have no energy to eat well, then maybe that's not the best way to start. Then that person needs a bit of help somehow else until they feel better, maybe with a non-hormonal prescribable option. And when they have a bit more energy, they can implement lifestyle. There is no point in saying this is the best starting point or that is the best starting point. The best starting point is what will be possible for the person and about their symptoms.
That's perfect. That's so great. Has hosting the podcast changed your own way, your own healing or perspective?
Yes, and you know what? The perspective that has really changed for me is I always realize I don't know anything. And I've recorded over 190 podcast recordings.
Mhm,
I always learn something new.
mhm,
I always need to remind myself things change, evidence changes, belief system changes, and so I need to keep an open mind. And initially, after the first 10, I thought, well, I've tackled it all. I've done everything there is to talk about, but I couldn't have been any more wrong because there are so many new things people want to discuss, so many intricacies, so many different people after different tumor experiences. And people are telling me more and more that the impact of menopause after cancer is so huge for them. They need to learn, they want to learn. And so, my perspective really changed when I realized keep your options open, Danny. It's never black and white. Everything has so many shades of gray. You know,
mhm.
like the sexy movies, 50
Yes.
Shades of Grey. It's the sexy menopause after cancer movies. It's definitely all the shades of gray, and we have 100 of those.
Yes, yes. And even sometimes is that, when I start doing the podcast and I start doing this as well as a platform for education, because I felt there was a lot of lack of education in a lot of the patients. And that was a way to kind of help them to navigate, right? So it's nice to see them pre-op and then, they just got this cancer diagnosed. 2 weeks later, they're here seeing us for a pre-op baseline measurements for lymphedema, surveillance and other situations. And they're super scared, right? So it's nice now to be able to say, hey, here is the podcast, and here is actually the surgeon who is going to be doing your surgery, talking more specific about it, or radiation oncologists, and a lot of these like great health providers, like as no, they're experts on what they say. But again, when you start interviewing a lot of other functional medicine and wellness medicine, then start to really, in my head, you start kind of, God, should I really, the things that you thought you knew or you believe is like, oh, maybe this is not the case anymore. And how do I manage this, right? Because it's like, again, I mean, a healthcare provider, hospital, traditional medicine. So it's kind of, you just gotta be careful how you suggest certain
Yeah,
things without, overboarding what or getting a conflict for what the physician is saying. So that has
yeah.
been challenging because it's like, okay, I don't know what to believe anymore. Like, do I believe this? Do I believe that? How do I put this together?
And my thinking was exactly the same as yours. And I now know, especially when we talk about menopause after cancer or many things like you have mentioned, it's never a this or that approach.
Mhm.
And I think that's what we have to get rid of. And it's if anyone is saying to you, it can only be this way or it can only be that way, I would be a little bit dubious and sort of say, let's reserve 5% for another option and another conversation. Because yes, like in traditional medicine and in Chinese medicine, there are certain ways, but as soon as you open your horizon to other ways of thinking and other schools of medicine, for example, there are many other things. And you don't want to confuse people, but my favorite word has become and. So this is true, and let's listen to someone else's idea on the same subject, and we don't have to decide. However, some people, it really resonates for them, like alternative therapies or complementary therapies, and for other people, it really won't. And there is no point in me talking about acupuncture to someone that A doesn't believe in it and B is scared of needles. Well, let's move on, find an and, let's find the other approach. And it's the other way around. I have so many people that say, Dani, I don't want any more medication to help me with some of my menopausal symptoms. I've had so much active cancer treatment, chemotherapy, I don't want it all. There is no point for me to suggest a medication that may be beneficial for their bladder dysfunction and their hot flushes if they don't want drugs. And then it's important to add the and say, let's look what is available for you. And I think then we don't have to go, it's this or that. Then we can say, yeah, I hear you all. And everyone can allow to make up their own mind.
Okay, that's a very good point. How can healthcare providers better support women navigating both cancer survivorship and menopause?
I think it starts with a conversation and an honest conversation. The problem now, we have in the UK polled a lot of people in cancer services and clinical nurse specialists, oncologists, and we have really listened to why they don't talk much about the menopause. And in some cases, it wasn't on their radar. In other cases, they just don't have the time or capacity to really listen and talk to people about their long-term quality of life and survivorship because they just have no resources. And in other cases, they don't want to talk about it because it's like opening a can of worms.
Yeah.
And if they don't have anywhere to refer their patients to, like a menopause specialist or a gynecologist, their patients tell them about all of their problems. But if you can't help them at all in fixing them or helping them feel better, it's a horrible situation for healthcare professionals. So it starts with a conversation, even if you know you're not going to be able to fix it all. And I think that's okay. Because one thing I've really learned from speaking to not just hundreds, but really thousands of survivors, listen to the fact that they believe that this can be a difficult menopause experience, that someone just acknowledges their experience can be enough for them to really feel in a much better state. And so I encourage everyone to have the conversation, to ask the questions, to go hands up. I don't have all of the answers for you. We currently don't provide adequate services for you to have help with all of this, but I am here to listen and I'm here to learn. And I think that's a really good enough starting point.
Yeah. And I think is just be able to make sure that they feel comfortable with that, right? Because it is okay for us to say, I don't know, but we can find more about it. Or
Yeah,
let's explore, let's look and see this person, or let me give you this information and try to look. But sometimes, it's certain providers that are very like on their set point is like, okay, here, like you say, here I hear from patients as well saying like, well, I'm just blessed that I'm alive and I guess I have to deal with this the rest of my life. And it's like, no, 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 this is not how it works, right? You wanna live. You don't wanna live like that, right? So sometimes it's like having just more openings to be able to say, I really don't know what other path because it's just out of my expertise, but let's look and see who else can help you with that. So,
I love that. And there are, the cancer space is very complex, of course, right? You could plow yourself into finding new treatments. There is lots of research going on. We, of course, need better treatments to treat more cancers and secondary cancers. There is so much to be done in this space. So when I talk about the management of menopause as a result of cancer treatment, of course, it's not going to be on everyone's radar.
mhm.
All I know is that by 2050, there will be 16.3 million people with ovaries who've had a cancer diagnosis. So
Wow.
16.3 million women with cancer. Now we know that the majority of these cancer treatments will make them menopausal. That will come with a lot of problems. So for anyone in an early menopause, we know their risk for osteoporosis, heart and brain conditions is going to be there.
Mhm.
So that will have a knock-on effect on our all of our national health services across the world because people will need support. And then it's also about symptom management. So it's a growing problem because more and more people are getting diagnosed younger. And
Yeah.
then the menopause has other impacts as well.
That's a very good point because then it's as well you start looking into what do I worry more about it, right? Sometimes I have this conversation with patients, you just put it on the table, like listen to all the research and the stats that your medical oncologist is giving you about the pros and the cons of having these endocrine therapy or hormone blockers, but just put it as well on the balance what is your quality of life looks like with one versus the other, and then you make that decision. But I love what you say earlier, but what else can we support you if you decide to go into that so you have less symptoms and people can be more compliant with it? So I really love what you say early on that. Why do you think menopause after cancer is still isn't talked about enough? And I think you already kind of touched a little bit about it's like open this kind of worm that people is like don't know much about it. Is anything else you want to say about that?
I think it's really going back to what you said earlier. Sometimes we do think, is this a trade-off for having survived cancer? And I do think there should be, and there are some trade-offs for having survived cancer, because a lot of cancer treatment is aggressive and surgery will change you. And we are very grateful for all of that treatment. I guess it comes back to my favorite word. It's like, yes, all of this has happened to me. I've worked really hard to get through active cancer treatment, and I also now deserve to look into options to improve my long-term health or to make sure my long-term health doesn't now decline because of it rapidly, and to help me with some of those symptoms so that all of the things you've gone through, you can now walk away with not just a very much impacted quality of life.
How do you balance medical information and the personal storytelling on your show?
Do you know what? It's something I luckily don't have to think about because I meet cancer patients who are in treatment-induced menopause or survivors every single month through my work, through our workshops. And so their stories is what really gets me out of bed and is that drive. And I have so much contact and in-depth contact and great conversations with so many survivors. They are my stories. Um, and then it's actually quite easy to feed that into and bring that back to our doctors. Every podcast is probably informed by 10 conversations I've had.
Mm.
And I know what our community wants to hear and want to listen to. And some of those topics are never on my radar. I had never even heard of those things before, but it is what our community wants to know. And then I start to facilitate.
Okay, that's awesome. And then, what can people get a hold of you? How can they contact you?
So I think first thing I want to say, if any healthcare professional is listening, we want to support them too. This shouldn't just be we're going to tell our patients to be more difficult and ask more questions. No, we want to support doctors and healthcare professionals of all sorts as well. So we can come in and do lunch and learns as an organization, introduce what we do. We can pop into an online Zoom room or a Teams room before clinic and do a 20-minute presentation of how we can support your patients. We also do courses for healthcare professionals. Our next one for how to manage menopause after gynecological cancers is coming up at the end of November. So we really do want to support healthcare professionals. For patients, it depends how they want to learn. Do they want to listen to a podcast? Do they want to watch a YouTube? Do they want to read a resource? Or do they want to connect to others in a private and safe Facebook group? So it really depends how people like to engage, how they want to learn. Some people are more, back off. They want to just listen. They go on a walk and they listen and learn. And other people are in the Facebook group and they want to ask all of the questions and chat to others to feel part of a bigger community. I think the best starting point is our website, menopauseandcancer.org. And from there, you can find support for you in all the different ways.
That's great. And to wrap up, what advice will you give to someone newly entering menopause after breast cancer treatment?
I would say have a cup of tea with yourself or a favorite coffee. Go onto our website and you will find a free symptom checker. It's a free PDF and it lists all of the menopause symptoms. And you can tick how much they impact you. Like, is it a hot flush a day, or is it 20 an hour, or is it insomnia? Is it joint ache, whatever it is? And you can then use this to understand more what it is you're experiencing. Because otherwise, your brain fog, it's like a bit confusing. And it then will also help you have a conversation with any healthcare professional. So they might come and see you and say, look, this is actually how I feel every month. Or they might see their oncologist or clinical nurse specialist. And I think that really helps to have a more informed conversation.
That's awesome. Is anything else that you feel I missed that you would like to uh, give us of all your expertise and knowledge of all these years doing this?
I just want to say thank you for having this conversation because years ago I was emailing people left, right, and center, begging them to listen to me, and people were like, "What are you talking about?" And so to now be able to talk to you, to being invited onto your show, to maybe have an hour to spread the awareness with your healthcare professionals and patients, it's amazing. I think it's something we can all do together. We can all do better. We can do better in our generation, I know, because we've already done so much great stuff. And it's really positive and really empowering and really uplifting when people know that they have options. And so that's what I'm really passionate about. And everyone walking away, that you have options too.
Danny, that has been amazing conversation. I really enjoy, and again, still learning like you every single time I interview someone. So thank you for your time and
Thank you.
for all the work that you're doing out there. You have amazing podcasts as well. I've been really enjoying listening to your show as well.
Ah, thank you so much. I think the only thing we haven't spoken about is sexual health, and it's a huge
Oh,
problem.
yes,
On another note,
yes.
people should go if they have any issues, because we know people have lots of issues. There are lots of podcasts and YouTubes around sexual health, bladder health, intimacy, all of those things we really know people are very much impacted by. So maybe people start their learning journey talking about vaginas and vulvas.
Yes, yes, yes. And this is actually something that I wanted to ask as well. And again, I know I want to try to be respectful of your time, but that's huge, right? Because we are thinking like, and I interviewed somebody the other day, haven't released that yet, talking about sexual health and sexual wellness after cancer in general, mainly breast cancer. But that's important because sometimes, like our libido goes down anyway after certain age, and then on top of that, this cancer diagnosis happen, and then certainly medications doesn't help. So people really think that, oh well, this is kind of the new life I have to live, and that just creates so much conflict with your relationship and as well with yourself. So how much of all that has impacted you?
Massively, massively, massively. And I think over 88% of breast cancer survivors are impacted by GSM symptoms, so the genitourinary syndrome of menopause, so anything to do with your genitals and also your bladder and your urinary tract. So it extends symptoms from a dry labia, so a dry skin on the outside. Some people sit down, it feels like their skin is cracking. So that's very painful. It could be painful intercourse or bleeding upon intercourse, all the way to feeling that you constantly need a toilet and you can't empty properly, or that you wet yourself. So a little bit of incontinence is a menopause symptom due to the low estrogen, but all the way to urinary tract infections, and sometimes they can be reoccurring. So that's a lot of really serious issues that really need treating and can really stop people in their tracks. And only once these are managed can we then talk about libido and that loss of sex drive, because no one would want to have any intercourse or intimacy if you're in pain anyway. But it's really looking at what can we do for those physical symptoms, and then we need to talk about all of those emotional, psychosexual symptoms. And it's a huge conversation that most people want to have. And I'm 12 years on and I'm still navigating a lot of these challenges myself. So it's ongoing is my answer.
Yeah, yeah, that's true. And again, that's one of the reasons as well that we kind of talk to patients about vaginal estrogen, right? How something that is very low dose and locally can make a huge difference. And I sometimes tell patients just question your doctor, and if this doctor doesn't really want to do it, go talk to your primary care or your OBGYN, or try to see what you can do, because I think if again, like you mentioned before, a lot of the patients who are hormone positive breast cancers are just being so afraid of, no, I cannot do anything hormonal. This is not good for me. And even though we know the research has been showing the opposite, that can really be a big game changer for patients.
Absolutely. And especially for patients on endocrine therapy, um, it could be really the reason why people might want to stop their treatment, the endocrine therapy. So it's often the joint aches and some of these GSM symptoms. And so we've got to question the bigger picture, the whole person. What are the aims here? And to really then research and find the people that can help you. Um, yeah, talk about sex, I guess, isn't it? Sexual
Yeah,
health.
yeah, that's exactly super important. So yeah, I'm so glad that you mentioned that, Danny. So I'm gonna let you go and continue enjoying that. What time is in England now?
Well, it's nearly lunchtime,
Oh,
and I know you're starting your day. Thank you for all of your hard work, dedication. It's really early for you, and you're trying to fit it all in. You're amazing. Thank you.
thank you so much, Danny, and you have a wonderful day.
Take care.
Bye.